Hello, we are going to be going over how to do the immunosuppression project and how to analyze the patient data to understand their initial immunosuppression regimen and anything that changed over time, whether due to infection or rejection. So if you can see my screen, I'll share the screen. All right, what we got to do is go to Citrix workspace. Wait, wait. Yes. Okay, there we go. We'll log in. Okay. So we're now at in Epic. We go to the patient station to search up the patient by the MRN. So this patient is 2. So this patient. So we'll see what their starting immunosuppression regimen is. To do that, we need to go through their chart and chart review. And I do it personally, I go to chart review, do it by type, load additional records, and then I find the first record of their transplant, when the transplant was performed. So you want to load all the additional records and make sure this is on up here to the right, because this is outside records. Sometimes the patients come in for the initial transplant, but then have appointments or admissions outside of Northwestern. So we're going to load all the initial documents to make sure this is on, to make sure we're getting all the notes we can. And then I just scroll down to admissions, because typically what we do, what we're looking for. And we'll see on the left-hand panel when the transplant occurred. So it was November 15th, 2022. So we know that all of this before isn't as important. So here's the test time frame is when the transplant occurred. So we can go into this note. You can see they remitted of this date, discharged. The transplant occurred during this appointment or this admission. You can read this overview of their procedure and their time spent and admitted. But then to get to the additional each appointment note, you have to go to additional notes and go to progress notes. And what I do is I look at the transplant service ones or the pulmonology ones, because those are the ones that typically talk about the immunosuppression regimen. So if it occurred on 15, there's typically the induction immunosuppression, which is just like the initial dosing to make sure that they're stable before and after transplant. And then there's the maintenance dosages. So we want to figure both out. So we can go to this person. Typically the PAs for some reason have the more in-depth notes so I like to go to those. And I scroll down trying to get to the transplant immunosuppression data. It's typically under assessment and plan. So here's the maintenance immunosuppression. Here's the induction that they did. So you can see right here, they did 500 milligrams of Simulect during the procedure, and they also did it 4 days afterwards as well. So that's important to note. And then you can see here, this is their maintenance immunosuppression plan. So right now they're going to have the lung transplant person dose and make order changes, but typically it's by like the levels in the bloodstream, and so they measure that and make sure it's always hitting that level. And so we'll look into that more later. Mycophenolate is 1,000 milligrams twice a day, and prednisone they're going to start a prednisone taper. This is a little different than normal. They're going to do an expedited prednisone taper due to age at the 2-week post-op period. So I typically come to these notes that are earlier on during the admission to get the induction, but I don't figure out the maintenance immunosuppression until I go to the last like note from their admission, because that's typically what they're going to be doing after their admission. So I go back to one of these transplant services on one of their last days, and you can go through this to see like the recommendations, but I typically also just go down to assessment and plan again. So they actually changed to cyclosporin because there was neurotoxicity and tremors on tacrolimus. So it's important to understand that. And there's an infection during their admission, so they went down to 500 milligrams of mycophenolate twice a day instead of 1,000. They're going to continue at it because of the low white blood count, and then they're still doing the expedited prednisone taper. So we just make sure we take note of all of that in the documents that we have. Yeah. Okay. So that's our maintenance dosaging. So it's important to know like why they discontinued tacrolimus and why they started cyclosporin, why they decreased mycophenolate due to this infection, and then why they chose to do this expedited prednisone taper because of their age. So we have that information, but now we want to see if after they left from their transplant, if their immunosuppression regimen changed at all. So we look at all of their admission. I typically just go through the admissions at first because I want to see like if they came in for if they were admitted for infections or for a rejection or something, if that caused their immunosuppression regimen to change. But there's two kinds of admission notes. There's the admissions here where they just like came in and wanted to be admitted, and then there was the ED, the emergency department to admission portion as well. So these are important to look at as well because these are also admissions. They just entered through the emergency department. So you want to look through all of these after the original transplant admission and see if the regimen changed at all and for what reasons, and if there were any infections, any rejections, or anything like that. And so let's see if this patient so you can go to like I guess one of these notes and just see if they so if you go to one of these admissions, this is the overall overview note, and you want to see like it's important to read like the indication for the admission and the hospital course as well. So it looks like there wasn't really from these hospital courses, they didn't really come in for infection or rejection, but there could still be changes to the immunosuppression regimen during this appointment, and it's good to keep track of like everything. So yeah, so you want to go to the transplant note, transplant pulmonary, or the pulmonologist notes. I mean, you can see their recommendations up top, and those are important. But I just go down to the immunosuppression. So this might not be the appointment. I wasn't doing chronological order, but you should do in chronological order. But you can see that this person's still on mycophenolate, 500 milligrams twice a day, so that's the same. So that didn't change. The prednisone taper, they always finish at 5 milligrams, and they're taking it every day, so that's as normal. But you can see here that they are holding cyclosporin, which is actually due to the tremors that they came in for. So even though they didn't come in for an infection or a rejection, the regimen still changed due to the tremors that they had, which could have been a side effect. So it's important to take note of that. You just want to do that for all the admissions appointments. And so besides looking at all these admissions, I also go down, if there's any confusion between admissions, like why did this change, I go down to office visit, because sometimes in the office visits you need to see like what they talked about, like these pulmonary appointments are important. So I scroll down to typically the assessment and plan again. Yeah, so here the immunosuppression regimen was sirolimus, cyclosporin, and prednisone. So you want to take note of that. And I'm not doing this in chronological order, but you really should do that to see how the regimen changes over time. I'm just showing you all how to find the immunosuppression regimens and what the different types of notes I've used. So this is the immunosuppression regimen they talked about here, which is different from what we've seen before. So you really want to take note of as much as you can. Typically, I start with the admissions, and if that explains everything, I use mainly those. But then sometimes there's questions like, why did this regimen change between admissions? I start from the first note of the admission to the last note of the admission, and I make sure that to see like, that. And then so I'll go through some of these pulmonary notes, the office visits, just if I need to clarify things between admissions. And then also I look at any oncology notes as well, because I want to make sure if there were any recurrent cancers or anything like that and when they occurred. So I don't see any here, but I don't think this patient had any recurrent cancers, but it's always here's a hematology oncology visit. But I believe this is for acute kidney injury. But yeah, I go through oncology visits as well, just to make sure there weren't any recurrent cancers and to figure out if there was any chemotherapy, because chemotherapy treatments can also change immunosuppression regimens as well. So that's typically how I do it. So yeah, I'll just to recap. I go to review encounters. I load all of the notes, make sure this is on. I go down to the admissions from when they came in for the initial lung transplant. Then I figure out, what their initial like induction immunosuppression is, and then their maintenance immunosuppression regimen is. And then from there, I go through all of these other admissions notes, both these ones and the ED2 admission notes. And I start within each admission. I go to all the way down and I go to all notes, progress notes, and I just go through the transplant service ones. Typically, I start from the first one to see if, since their last admission has their immunosuppression change from their initial entry to admission, and then I look at the last note to see if their immunosuppression regimen changed at all while they were admitted. And if it was, sometimes I look at some of these other services to see how many times they changed during the admission. But yeah, I start by looking at the first and last transplant service notes. I do that for all the admissions, and then if there's any confusion, I look at the office visits notes as well, which are down alphabetically under O. So yeah. And then, yeah, it's important to make sure you figure out if there's any people, if they were admitted for infections at all, if they were admitted for rejections, and then any other things that could have caused changes to the immunosuppression regimen. So you want to make sure you get all of that information down and look for that as well. And the infections for intermission should be within summaries or within the microbiology data in there. So that's how I do it. Yeah.